Thank you so much for joining us here at Abu Dhabi Global Health Week, the inaugural summit here in the UAE. One question that I would have off the top is, in your mind, where are we post-COVID-19? Are we ready for another pandemic? Have we moved as quickly as perhaps we should have?
First of all, I just want to thank the organizers for inviting me to speak here today. I think this is a great event where I met a lot of people that speak the same language, that focus on our mission in extending healthy lifespan for the benefit of all, and this is what we see today. To answer your question, I think it's a very important question. Obviously, in COVID-19, you see a lot of scientific developments that happened, a lot of innovation, a lot of interventions that actually happened. However, I truly believe that there are more efforts that should be put in place and more of a collaborative framework that bridges between the private sector and the public sector. And this is where we, as a foundation, play a very important role. I mean, at Hevolution Foundation, we've extensively focused on how we can bridge the gaps in these challenges. How do we enhance collaboration and conversations between important stakeholders? How do we influence regulatory reform? Some examples is how do we drive policy change? It's very important to share data. So I think everyone knows that data sharing is a huge gap. You can't intervene if you don't know what's going on. I mean, that's one. Second is, where do you fund? Where do you place your funds? And Hevolution really highly focuses on placing funds in early healthcare research, in understanding the biology of aging, understanding why do we develop disease when we actually age. Also, we invest in impactful investments. We've just made our 2 first investments that focus on targeting certain pathways that contribute to the development of aging diseases. And also, we're starting to influence the incubation of brilliant ideas that drive healthcare impact. So we started our incubation program. And we're also moving and transitioning into platform investments that helps us understand the complexity of aging. Not only that, it's also very important to enhance or improve international collaboration. And this is through a call for action. A call for action that focuses on how do we build an ecosystem that helps in innovation in healthcare, changing the thinking process of people or healthcare systems that are reactive to more of a proactive healthcare system. So I believe a lot of these elements that I just talked about now will enhance our reaction towards any pandemic that we hopefully not face in the future.
What in your mind is the single greatest impediment to that kind of agility?
The most important are simple things that are very difficult. Is how do we find an area where our incentives are, between the private sector and the public sector, where they collide. And I think that's very important. Public sectors have certain incentives, the private sector have certain incentives. And I think finding that middle ground is key for any innovation, especially in healthcare.
Yeah. When you think about the premise of this conference, which is essentially to get beyond healthcare, to really focus on health, we're talking about how this will impact millions of people over the course of the next few decades. So much progress is being made. Where do you see the role of AI?
Of course, AI is an enabler. I mean, these are tools and technologies. Speaking about Hevolution, we're considering AI in elements that focus on developing tools and technologies that can expedite drug development. So AI has proven that. However, AI can also be used extensively, not only finding targets for certain drugs, but also understanding the complexity of aging biology. So aging biology is very complex. And we call this, it's a term that we use in science, it's called system biology. So how do different pathways interact with each other, how different organs interact with each other, and how does the whole body function as a body? And this is where AI can play a very important role in helping us understand this complexity.
So much of this is about finding the money, finding the financing that's necessary.
Sure.
to get folks on the right track. And when we think about the kind of money that big pharma has today in terms of market cap, it's $4+ trillion.
Sure.
To your mind, what you're doing now, what you're focusing on now, and the idea of moving from palliative care to care today, how much of that in your mind is going to find the money? Because if you look at the beauty industry, we're also talking about $1 trillion industry.
Sure.
But if you can reverse aging, that has an impact much further than the physical.
So, is there a gap in funding aging or health span research? Yeah, there's a huge gap. Can Hevolution do it alone? Most probably not. We really need to catalyze the field, attract multiple investments in this field. So what we're doing and what's our mandate is obviously to impact the field through putting our funds in the right focus areas, drive more impactful investments, and also attract people and catalyzing people to invest in more mission-oriented focus areas, which is health span. So to answer your question, there is a gap. We've already committed as Hevolution Foundation up to date since the past 18 months, almost $300 million US, ranging from scientific geoscience initiatives all the way to impactful investments. However, the need is there. Hopefully Hevolution can play a role in increasing the flow of funds where they actually need to be.
It's interesting, isn't it? Because many would say that the pharmaceutical companies don't necessarily want to weigh in here, and I sense that they're going to continue to make a lot of money over the next decades on the kind of care that we see them providing today in terms of drugs, because there's a lot of money in that vein. How do you combat that in terms of the image? How do you shift that narrative?
I think shifting that narrative is by educating people from the private sector and public sector about impactful, mission-oriented, long-term returns versus quick returns. Because in order to solve for a challenge that's as big as aging, you will have to take very important steps to do so. However, at the same time, I think you can see a shift where in pharma these days, you can see a shift in how they think. We've been speaking to a lot of pharma that are interested in the aging field, and I think you're seeing the movement changing a bit more towards how pharma will drive R&D in the future. And this is where I think the health sector is going to shift towards, is how do we unify our efforts in research and development in the next century or so.
How important do you think a drug like Ozempic has been to creating that shift? Because people now realize that, there is a value to living a more full and healthy life, and people are willing to pay for it.
So Ozempic is one of an example of a drug that was repurposed. So it was mainly for diabetics.
Yes.
And now it's targeting pathways that are related to obesity, which I think is a good start. As in the field of aging, we are, and as Hevolution, we are focusing and transitioning into focusing on how do we explore repurposing certain drugs to decrease age-related diseases and increase health span. So to answer your question, this is an example of a lot of the steps that we can take forward as Hevolution Foundation, and we're actually exploring. So in my personal opinion, I think, as you can see, different approaches of repurposing work, and I think it can be implemented in the aging field.
How much was your research and your sort of, I suppose, overarching narrative related to aging population, giving people the opportunity to live a longer, healthier, and much more full life as a result of being able to reverse the aging process? How much has that informed what you do?
I mean, it is the main driver of what we do. I mean, we do have stats that are informative. For example, the average age of humans across the globe is 72 years of age. However, there's data that shows 10 years within those 72 years are actually people living them with disease. So these are facts. If you come to the region in GCC, I'm talking about Saudi Arabia, the average age of a Saudi is 30 years of age. But also there's a tiny, I wouldn't say alarming, but informative information is that we develop age-related diseases younger in life.
Yes.
This has all informed what we're actually doing. However, we don't think of it as a challenge. We really think of it as an opportunity. The reason why is what can we do today to prevent economic crisis in 20 to 50 years? And I think this is the importance of the conversation today. And this is the framework that I talked to you about has to, or hopefully will be adopted to implement a lot of these changes that we see today.
It's not only quality of life, then it's also cost savings for economies.
Of course.
So it behooves governments to get involved.
I agree.
So great to have you on the program.
Thank you so much.
Thank you so much for joining us.
Thank you. Thank you. The pleasure is mine.